I am highly sensitive to prescription medicines, even in small doses. Everyone in my family is. My brother's suicide was Prozac-induced, meaning that he was on Prozac for less than a week. A very small percentage of patients who go on Prozac, which is a very popular antidepressant, become suicidal. My brother, unfortunately, was one of those people. So apparently, and I am also highly allergic to many medications. The whole penicillin family, any number of blood pressure medications. Thank God for Dr. Nadim, who knows the book on blood pressure medications. She saved my life by getting me on the right blend of blood pressure medications. I want to tell you a little story, though, about when you're in a situation like being on dialysis where you have no end game other than transplant. And transplant, if you don't have live donors who are acceptable, becomes something that's way, way down the road. The average waiting time in the Los Angeles, the greater Los Angeles, Southern California area for a deceased donor kidney is 7 to 10 years. Most people who go on dialysis, certainly about 25 to 30%, will not make it because they have pre-existing problems, because of age, whatever. They will die before they get a kidney. So and the longer you're on dialysis, the more problems you will develop. You will develop with heart disease, with vascular problems. Dialysis is not a perfect form of treatment. It is a way to keep people alive until we can find something better, basically. But you still want to live. You still want to go places. You begin to feel better. My wife and I have enjoyed going to Santa Fe, New Mexico many, many times. We have friends there. I asked my nephrologist at the time, this was back in the summer of 2004 when I was having all the blood pressure problems, could I go to Santa Fe, New Mexico? How many of you have been to Santa Fe, New Mexico? How high is it, altitude-wise? It's over 6,000 feet up. Okay. When I walked into the dialysis clinic in Santa Fe, every patient had an oxygen mask on. I didn't know this. I lasted 4 days in Santa Fe, New Mexico. I love the place. We had to cut the vacation short. Why? Because I was on Norvasc at that time as one of my main blood pressure medications. It's a very popular blood pressure medication, very effective, except not with David Rosenbloom. With David Rosenbloom, it didn't lower my blood pressure, it raised it. I was on a couple other drugs too at the time. One was the minoxidil, which is a much older drug but seemed to work for me. It also makes hair grow everywhere. Okay, it's great when you have a bald spot. But if you're a female, you don't want to use it. Okay. Norvasc prevented me from sleeping. I started to hallucinate. My allergies were bothering me. We were renting a casita that was in the middle of a large field with a lot of wildflowers. Beautiful, beautiful place. But clearly not for someone with high blood pressure and kidney disease. The story that my wife likes to tell all the time is, in the middle of the night, if I could fall asleep for a half an hour, I would start hallucinating, and I would literally be sleepwalking. I would get up, and I would tell her that she had to get out of bed because I had to fix the bed because the bed had fallen apart. Okay, this is the woodworker in me. Okay, you know, the mattress was on the floor, and we had to get up. And she was going out of her wits' mind. She didn't know what to do. We kept talking to the doctor on the phone, and finally we decided to come home. About a week after that, I stupidly went to a spa out in the desert, came home that night, and developed pulmonary edema, which means water on the lungs. I could not breathe. We rushed to emergency. I was given a ventilator, which is a marvelous machine, by the way. and was able to breathe again. And then put under very heavy sedation, kept in the hospital for 5 days, and my nephrologist, working with a cardiologist, determined a blend of medication that would bring my blood pressure down. It was one of the best weeks in my life. I've never been high before. I've never taken drugs. Supposedly there were visitors that came to see me. I don't remember. One of my friends gave me an iPod, which was brand new, and he had loaded it up with great music, and I thought I was floating on a cloud, and this must be what heaven was like. We managed to control the blood pressure to some degree, much better than it had been, and I still was not satisfied. And at that point, because of my connections, I have long-term connections with USC, I decided to find a blood pressure specialist, and that's where Dr. Nadim came into the picture and put me on a wonderful drug called labetalol. Thank you. Which I'm still on, by the way. Works wonders.